President.
Senator from Louisiana.
Mr. President, are we in a quorum call?
Senate's in quorum call.
I ask that the quorum call be vitiated.
Without objection.
I'll note the only time I use the word vitiated is when I apply it to a quorum call. Mr. President, obviously the big topic before our country right now is what do we do about rising health care premiums? And what we know under the Affordable Care Act, or the Unaffordable Care Act, Obamacare as some call it, is that premiums are rising more and more. And one of President Trump's campaign pledges was that premiums would come down. And actually come down with, as he said in one place, I think, beautiful coverage. That actually it's good coverage and premiums are lower. So let's kind of set the stage. I just got a message on my Facebook page, Mr. President, and let me just read. And by the way, anybody can post on our Facebook page these sorts of stories. We're interested in them. Brian from Covington, Louisiana, sent a message saying, "My family plan is $1,700 a month for me, my wife, and 2 children." Okay, so we're roughly, Mr. President, about $20,000 a year. The ACA, the Affordable Care Act, has brought me to my knees. I hope we can get something done as my credit cards are all maxed out. 80% of my friends are in the same situation. The middle class is dwindling away. Can everyone just come together and figure this out? Think about this, Mr. President. $17,000 a month. He did not write this, but what would be standard for this sort of policy is a $13,000 family deductible. I say that because I have an acquaintance in San Francisco. San Francisco is so expensive for housing, transportation, food, you name it. And their premium for their young family is $20,000 a year. Each family member with their own separate $6,000 deductible. This is under the Unaffordable Care Act, as I call it, or the Affordable Care Act, as others do. A friend of mine back in Baton Rouge, I've quoted this many times, put it on my Facebook page because people would not believe. He and his wife, 60 and 61, their quote for their insurance last year was $39,000. Their quote for their insurance was $39,000. And then I spoke to a fellow who is an insurance consultant here in Washington, D.C. An insurance consultant, if anyone could get their premiums down, it would be he. For his family, their premium is $24,000 a year with a $13,000 family deductible. If they get in a car wreck, their family will be out $37,000, Mr. President, before the insurance kicks in. Who can afford this? We must do something better. I will say when President Trump ran for office, President Trump clearly recognized this. He said on the campaign trail over and over, he wished to lower premiums. And it's the president's genius, if you will, that he knew how to do so. You do so by expanding the risk pool. He said he wanted to continue coverage for all. He gets away from the Obamacare mandates, which people hate. The American people don't like being told what to do. And he also said he would care for those with pre-existing conditions. And this is how it works. When you cover many, you have a bigger risk pool. So those with pre-existing conditions have the cost of their illness spread out over the many, so premiums come down for all. Mr. President, hats off to the president for coming up with that. In fact, just before, 5 days before he was sworn in, he kind of echoed this, because one way to lower premiums, Mr. President, is to give poor coverage. One way to lower premiums is just to give folks such terrible coverage it doesn't cost anything. On the other hand, it doesn't cover anything. And again, the president seems to know this. 5 days before he is inaugurated, he says to the Washington Post, people covered under his replacement for Obamacare can expect to have great health care. It'll be much simplified, much less expensive, much better. And we have another. We're going to have insurance for everybody, Trump said. There was a philosophy in some circles that if you can't pay for it, you don't get it. That's not going to happen with me. I am a physician, a doctor, Mr. President, and again, I just admire the President Trump's insights. As a physician, I know that whoever wants health care gets health care. 20 or so years ago, Congress said if you walk into an emergency room, the emergency room has to take care of you. It doesn't matter if you're an American citizen. It doesn't matter how much it costs. The hospital has to take care of you. I tell folks when I was practicing, it would be the middle of the night, and as long as that emergency room was open, and it was open 24/7, in through the door came folks vomiting blood, heart failure patients, folks with drug overdoses, schizophrenics, diabetics, asthmatics, you name it. They came through that door, and we cared for them all. And somebody paid. Now, Mr. President Trump understands that even if you say you can't afford it, everybody's going to be treated. That's our current system, and that's not going to happen under his watch. Now, we mentioned that one way to lower premiums is to give poor coverage. I think everyone knows, or many people know, of Mr. Kimmel, the late-night comedian, who pointed out that when his child was born, instead of celebrating and handing the baby to the mother, and so the mother could kiss and the father, Mr. Kimmel, could cuddle, the nurse, the doctors looked at the baby and immediately recognized something wrong. They recognized that this child was blue, he didn't have oxygen, and if something wasn't done immediately, this child would die. And folks criticize Mr. Kimmel for being emotional. I totally get it. Instead of cuddling, you're signing a release waiver so your child can be transferred across the city of Los Angeles for emergency surgery. And in his emotion, he asked that all children, and I would expand all Americans, have the ability to get that sort of emergency care done. Again, the president was about that. And so I came up with what I call the Kimmel test. And again, it echoes President Trump's contract with the American voter, that we would protect those with pre-existing conditions, that we lower premiums, but as we lower premiums, we make sure that that coverage is adequate. So the Kimmel test, making sure there's adequate coverage while lowering premiums, caring for those with pre-existing conditions, that is so compatible with what President Trump has said, because Americans need lower premiums. Now, let me just echo one more time. We need to lower premiums. And the president's approach, the contract he made with the voter on the campaign trail, is the right approach. You get a bigger risk pool, lots of younger people. So those who are older and sicker have the cost of their care spread out among the many. Now, we have a plan, the Cassidy-Collins plan of the Patient Freedom Act, that I have introduced with Susan Collins and 4 other senators, and we have a way to go about that. One way we do it to get young, healthy folks involved is to do something what we do on Medicare. If you're eligible, you're enrolled, unless you call up and say you don't want to be. That's what we do with Medicare. By the way, it's what Fortune 500 companies do with their employees for 401k plans, and it works really well. The employees are 95% likely to participate in a 401k, and they love it. People on Medicare, 99% stay on Medicare, 1% call up, say I don't want it. Usually they have better coverage someplace else. But as a rule, no one feels coerced because all know they can call up, I don't want it, I don't get it. But as it turns out, most do. So the plan we've taken with Cassidy-Collins in our attempt to fulfill President Trump's contract with the American voter, we allow a state to automatically enroll folks. And you'd be in. The credit you received would be sufficient to pay for the annual premium. If you don't want it, call up, make it easy, get out of here, I don't want it. But as a rule, we think that folks would be in. And by doing this, you expand that risk pool so those older and sicker and those with pre-existing conditions can have their conditions cared for, but we fulfill President Trump's campaign pledge. We also lower those premiums. Now, ultimately, to lower the cost of insurance, you have to lower the cost of health care. And Cassidy-Collins does that with some conservative approaches that even liberals will like. One way is we put in what is called price transparency, that you would know the price. The mother would know the price of a procedure, an x-ray, a blood test, before she gets it for her daughter, as opposed to finding out 6 months later when she gets the final bill. Let me give one example, Mr. President. We've all seen those urgent care centers. Now, some are run by hospitals. Typically, a visit there is going to cost you $500 to $1,500. Others are run by just a group of physicians, and maybe a small business that decides to set up an urgent care center. The same visit might cost you as little as $75 to $150. The patient doesn't know that till she gets the bill. Now, one door, exactly the same appearance, exactly the same type facility with the same capabilities. In one door, it can cost $500 to $1,500, and in the other door, it can cost $75 to $150, and the patient never knows. Now, I think we can lower the cost of health care by giving the patient the power of knowing what the price of health care is. Think of it, you walk up to a French restaurant in a city you're not familiar with, and you look at the menu posted on the door, and you see the prices of the food. And, oh, well, the food's pretty good, but look how expensive it is. Let me go down the street. And you go down the street, oh, food looks good, and it's less expensive. The power of price informs the patient what is the best deal for both her health and for her pocketbook. So one way we can lower the cost of health insurance is by lowering the cost of health care. There's other ways of doing so as well. But let me return once more to what I said earlier. Americans need lower premiums. And President Trump, during the campaign, his contract with the voter, I think, is the right approach to get there. And I'll summarize with this. He said he wanted to maintain coverage for those who had insurance, lower premiums, pre-existing conditions would be cared for, eliminating the Obamacare mandates. If we fulfill President Trump's goals, and these are goals that folks on the right and the left can get behind, and by the way, if we do get behind, premiums will be lower. And if we can fulfill President Trump's campaign contract with the American voter, we will lower those premiums, and we'll do so by achieving these other great goals. Mr. President, I yield back, and I note the absence of a quorum.